Good morning. My name is Samuel Quizon, and I will be discussing module number 3 that will provide a step-by-step guidance on local demand generation plans. So by the end of this module, the participant should be able to adopt and or develop yung local demand generation and communication plans and activities nila for their localities. So why is this important? Because on the ground implementation for demand generation and yung mga communication plans and yung activities na gagawin at the city level, the provincial level, the barangay level, will be spearheaded by you, the local authorities. So it is understood kasi that the local authorities such as yourselves will have a better capacity in understanding yung respective situations and needs of your constituents, and therefore will be more capable in making and planning the decisions, in allocating and mobilizing resources. So hopefully by the end of this module, you should be able to develop a local demand generation and communication plan and activities for your area. So before we move forward, let me first discuss what is the playbook. To assist local health authorities and local government units, we at the DOH Central Office develop what we call a playbook, which is an end-to-end guide. It's an end-to-end operational guide with actionable steps on how to implement the strategies and activities for demand generation and communications. So the expectation is if an LGU implements the recommended key steps as discussed in the playbook, it will effectively generate the demand for COVID-19 vaccines. So the playbook na I'm going to talk about summarizes the key steps that is recommended to be undertaken by local government units to effectively and comprehensively implement demand generation and communications within your localities. So these steps are outlined and described in detail in the playbook to be provided. So the key steps are, which will be discussed during this module, are the following. Step 1 is to establish a local vaccine operations center with a team for communications, advocacy, and partnership, with a clear organization chart and key stakeholders represented. So hindi lang naman pwede kayo-kayo lang na health authorities or local government authorities, dapat represented din naman ng mga key stakeholders ninyo. Dahil especially important yun for communications, advocacy, and partnership. Then step 2 is to adopt a local social mobilization and advocacy microplan. So ito yung na-mention kanina sa Module 2, na the local government units should develop a local microplan for social mobilization and advocacy for demand generation. You can adopt the microplan from the provided template. Now we're going to be sharing with you, and then submit it eventually to the Center for Health Development or the DOH Regional Office for consolidation. So hindi lang naman kayo out of the blue gagawa ng microplan ninyo. We'll be providing a template with a list of activities and a list of indicators na you can adopt depending whether or not it fits your context or it's appropriate in where you live. So for example, baka naman yung mga TV activities, it's not appropriate for your area. Mas appropriate pala ang rondilla, yung pag-iikot ng tricycle driver, yung mga town criers. So this is just a template. Pero there are recommended activities na you should do. So I'm going to flash it later, don't worry. So after step 2 is step 3, facilitate town hall meetings, orientations, participative planning, and other strategic activities. And then you submit the M&E data, the monitoring and evaluation data, and documentations of the town hall meetings to the Center of Health Development. Just to make sure na well-documented din syempre yung mga ginawa ninyong activities, dapat lahat ng monitoring, documentations, pictures, sinasubmit nyo rin for sa Center for Health Development ninyo. Step 4 is to conduct a modular cascade, yung capacity building of stakeholders. So that's why we're going to be providing to you a copy of yung recorded and yung actual presentations namin na ginagawa ngayon para it can help you cascade and capacitate yung different stakeholders ninyo in your areas. So hopefully that addresses some of the concerns kanina sa chat na lumalabas. So after that, step 5 is to activate social listening tools and collecting data. So conducting surveys and activities to collect social data on perceptions or information gaps on the ground. I'll talk about it later then. And I'm just summarizing the steps. Then step 6 is to assess yung inyong microplan, yung local task group strategies and activities through a developed monitoring and evaluation framework to further improve your local plans. And then step 7 is to activate a crisis communication system if necessary. So I will be explaining this later. So going on to the first step of establishing a local vaccine operations center. So all the LGUs are recommended to establish a local vaccine operations center with a team specifically for communications, advocacy, and partnership. So the role of the team kasi is very vital in ensuring the success of vaccine-related demand generation and communication in all fronts. So an LGU representative is recommended to lead the team. Siyempre, the LGU is the main implementing agency for COVID-19 vaccines at the local level. A technical working group may be formed under the team to guide the planning, development, and implementation of the localized microplan. The team may include the following, so yung mga naka-flash, pero not necessarily limited to the following. No? The following representatives of the LGU. So pwedeng nandyan si city or municipal health education and promotion officers ng ating mga HEPOs, the information officers, the public information officers, representatives from the disaster risk reduction and management offices, and the different barangay level representatives. So baka maganda pala for your area na may representative for the team on advocacy, communications, and partnership. Nandiyan yung mga, baka gusto nyo isama ang inyong mga BHWs, BIRDs, yung mga barangay DRMOs, mga barangay officials, and other key community stakeholders, no? Baka mga community leaders that can serve as part of the team or a technical working group that will support the team. And then other agencies and other stakeholders may be invited to be a member of the local vaccine operations center or the TWG. So for example, the DSWD recommended to be included, the local DSWD, for example, to assist with the indigent eligible population for COVID-19 vaccines. As one of our priority areas, no? Yung indigent eligible population. Your next step, step number 2, is for the LGU to adopt and or develop a local social mobilization and advocacy microplan. So it is recommended that the LGU develop a localized and operationalized microplan aligned with the national plan for COVID-19 vaccine demand generation. So itong sinasabi kong national plan for COVID-19 vaccine demand generation, we will also upload this in the Google Drive link. Now we will be sharing with you by the end of this TOT, Training of Trainers. Para at least you can align your microplans to the objectives, for example, of the national plan. So the microplans are to be submitted to the DOH Centers for Health Development for consolidation. So a microplan template will be annexed or included in the playbook and also provided in the Google Drive so that the LGUs can be assisted in developing their own microplans. So this is just an example of yung sinasabi kong microplan template in the previous slide. So this is what the template looks like. It's going to be a downloadable Excel file. It has already, on the leftmost slide, I don't think it's very readable. The leftmost column, it already has the provided activities. And then in the next column, it has the indicators. So yung mga activities na yun are recommended to be adopted if applicable to your context. You are also allowed and even encouraged to add, revise, remove, or include more activities and indicators as necessary. So you have this working template. You can adopt it as is if it's applicable to your setting. If not, you can remove, add, include more activities and indicators. But at least you have a baseline. So you're not working from nothing. No? So we're going to be providing you a template. So just to summarize the previous slide on the microplan, the template has the following components that needs to be filled up by the LGU before being submitted to the CHD for consolidation. So there's the region, province, city, municipality, barangay date, and then yung actual meat of the microplan, yung activities, indicator, targets ninyo, nyari ilan ba yung kailangan ninyong streamers na malagay, or ilang percent ng mga barangay captains ang dapat ninyong ma-orient in terms of for COVID-19. So yan po yung mga targets. As yung baseline, time frame, sino bang responsible sa inyong team to do the actual mga activities, yung budgetary requirements, funding source, and mga remarks. May space din for you to put yung mga remarks. In planning your activities and strategies for demand generation and communications, you must consider the use of data and the monitoring and evaluation. So social data is essential in the development of your microplans. It will help you to understand your eligible population in your more, particularly on what they think and feel about COVID-19 vaccination and factors that may influence their decision to accept the vaccines. So social data can come from anywhere, no? It can be from COVID-19 vaccine hesitancy surveys, from yung mga CAP surveys ninyo, mga qualitative studies, such as those that capture yung perceptions ng inyong mga eligible population, or hindi naman kailangan strictly research or survey, yung mga community consultations ninyo. You can find out kung ano ba yung perceptions or fears nila. So in terms of developing your microplans, that will inform on the planning. Dahil you would know at least kung ano ba yung mga concerns that you have to address, ano yung mga barriers na possibly ma-encounter nyo, and you can plan your strategies and activities for your microplan to actually address that. So not necessarily just mga surveys or mga community consultation. You can also use other social listening platforms such as social media, for example. Kung meron kayong LGU page, so kung may mga nakapost dyan, mas ma-understand din naman siguro yung mga hinaing at saka mga feelings na inyong mga constituents. So the microplanning will require the use of local data to inform on the design and targeting of specific activities. Tapos yung monitoring and evaluation indicators with the corresponding baseline and targets must also be included in the microplans, from the previous slide na. For example, if your objective is to increase trust in the new vaccines, you can determine an indicator such as yung percentage of adults who would trust new COVID-19 vaccine moderately or very much. So that's a sample indicator, no? So, i-monitor nyo yan, pwede nyo i-monitor all throughout the implementation of your microplan. Tumataas ba, parang pag ini-implement nyo ba ang microplan nyo, tumataas ba yung percentage of adults who would trust the new COVID-19 vaccine? If throughout your demand generation and communication campaign, for example, in your municipality and city, yung indicator na ito, bumababa pala. So baka naman, you have to change your strategies, no, on how you approach your constituents. So that's just a sample indicator. In your microplans, you will be developing we already have sample templated indicators where you can always revise and include your own. Another key consideration in planning and developing your microplans is the need to properly engage with the eligible population. It is necessary to ensure that the eligible population has access to essential information about COVID-19 vaccination through appropriate platforms and feedback mechanisms. So to ensure that their concerns are heard and addressed. So appropriate communication activities must be reflected in your microplans. So some individuals kasi who may be eligible for vaccination, such as persons with disability and those living in remote areas or yung mga indigent population na nasa priority natin, may not have or have limited access to common communication platforms. So in terms of planning, this must be taken into account so that appropriate communication approaches and activities and strategies can be determined. So before microplanning, it is essential to determine who might have limited access to information and who might have difficulties in coming to the health center or vaccination posts so that specific activities may be identified for them. So for example, nasa area ka na yung connectivity ng internet is only for 25% of the population. Maybe the internet in terms of your planning is not the best way to approach or to engage yung eligible population. So those are some of the things that you will consider in developing your microplans, no? In identifying your strategies and activities. So the last key consideration for local planning for your microplans is the need to mobilize partners, local leaders, champions, and other influencers. Na-mention na ito sa previous module. So generating demand for COVID-19 vaccination requires not only the engagement of the eligible population, but also community members who can directly or indirectly influence their decisions. Thus, yung microplans ninyo should also include specific communication activities such as briefing and orientation sessions and participatory planning for various stakeholders who can serve as your champions. So before microplanning, it is essential to map or identify community leaders such as, for example, very influential in your area, the religious leaders or the IP leaders. Baka maganda ang engagement ng mga civic-oriented groups or local NGOs within your communities. So baka we can capacitate these champions. They can be empowered with more detailed information about the COVID-19 vaccination and have them participate in the development of the rollout plans, development and implementation of the rollout plans. No? These influencers are essential in building trust in COVID-19 vaccination as well as in combating rumors and information about COVID-19 vaccines. So after forming your team for communications, partnership, and social mobilization, and then you've also already developed your micro plan, your step 3 is now The next step is step 3, which is for the LGU to implement the social mobilization, advocacy, and social and behavioral change activities identified in the microplan. So after planning, after developing your microplan, implementation na. So this involves utilizing different platforms and approaches to engage the eligible population. It is necessary to ensure that the eligible population has access to essential information about COVID-19 vaccines through the appropriate platforms and feedback mechanisms, yung nga nasabi ko kanina. So to ensure that their concerns are heard and addressed. Some ways na you can engage communities include the following, naka-flash siya right now. You can meet face-to-face or by phone or by online meetings or organize community virtual dialogues, depending on the appropriateness for your context. So it depends, you will know best as the local authorities on how best to engage them. You can include communities in the immunization plan development and review, meaning participatory planning. Determine how members of each community prefer to receive information and communicate. Baka that's a good step. Test messages with communities representing different demographics, perspectives, and priorities. Identify points of their contact for direct access. Provide regular updates through different communication channels. Use of the quad media to cross-promote activities. And then finding out who are the advocates, ambivalents, and adversaries within your respective communities. So that's some of the ways that you can start engaging your communities. As mentioned in the previous step, step number 2, we will provide a microplan template. Now that can be used as a starting point or a guide by LGUs. So the microplan template already has recommended activities that can be adopted by the LGUs, but the LGUs can also develop their own using that as a basis, no? So yun yung mga recommended actions, pero if not appropriate for your area, you can revise it. It is essential that the determined activities and indicators in the microplan be monitored and documented and regularly submitted to the Center for Health Development for bi-monthly monitoring. So, yun nga, dapat meron lang ding documentation, monitoring, and evaluation that hopefully will be submitted every bi-monthly, meaning twice a month, to the CHD just for monitoring. Next step is after implementing the activities, which is in step 3, the next step is step 4, wherein the LGU is recommended to conduct a modular cascade to key stakeholders that can serve nga as our champions for communicating our key messages. So as previously mentioned, generating demand requires not only the engagement of the eligible population, but also of community members who can directly or indirectly influence their decisions. So to standardize the cascade of information, all of the people, the participants here, especially the implementing health authorities and local government units representatives, will be given yung pre-recorded modules and yung mga presentations so that yung may standardized siya in terms of yung cascade of information. We will upload this later in the Google Drive as well. So we're hoping na may standardized kasi tayo na cascade of information for targeting key stakeholders. The modules designed to provide a standardized approach for capacity building. So this table is included in the playbook that will be provided in the central Google Drive. This table just essentially recommends to whom the provided pre-recorded modules may be cascaded by the LGUs based on its content. For example, the first module can be cascaded to the following community frontliners. And then the second module, the third and fourth, and then the fifth. So after the capacity building of stakeholders in step number 4, the next step is step number 5, which is activating social listening tools and collecting data. So social listening is the process of determining and monitoring the concerns and conversations to understand what people are saying about current topics or issues such as the COVID-19 vaccine. So social listening allows the communication team to prioritize and evaluate feedback from the public in order to more appropriately create messages with relevant content for target audience. So for example, hindi naman pala lumalabas sa inyo in your area ang concerns about halal ba ang vaccines. Di ba minsan may mga ganong misinformation or may mga ganong concerns, no? So baka hindi siya necessary to include an activity or messages that targeted that specific concerns. So that's something that you will find out during your social listening. Ano ba yung mga concerns? Ano ba yung mga perspectives na kailangan ma-address? So through this communication, your plans, activities, strategies can be adjusted based on trends and continuously shift your strategies to fit the current needs of your target audiences. So mamaya in the succeeding module, mas in-depth yung discussion namin ng social listening tools. So I will not talk about it this in-depth for my presentation. May separate module kasi for this. After activating the social listening tools in step number 5, The next step is step number 6, which was already mentioned in the previous steps, is the monitoring and evaluation of the local plan. We included a separate step for it to emphasize the need to determine, monitor, and document the indicators so as to assess and evaluate the local plan kung na-achieve ba niya yung objectives niya or not. The monitoring updates of the indicators in the local M&E framework, the monitoring and evaluation framework, will be requested from the LGUs to be submitted to the CHDs, hopefully twice a month, no? Para lang we can oversee and check kung ano na ba yung nagiging progress ng activities in the microplan ng mga LGUs. There are already sample indicators included in the microplan template, as we said. So, nandyan yan, nakabox na red. May mga sample na that can be adopted, revised, or added to by the LGU as appropriate. So for example, one of the determined strategies in your microplan is to orient all of your BHWs on the key messages of the COVID-19 vaccines campaign. And your determined indicator and target is that gusto ko 100% of all target barangay chairman, BHWs, and birds are oriented. So the LGU will monitor, then document yung progress nila and report their updates to the CHD twice a month. So ganun lang indicator. Next step, yes, this is my last step. The last step, or step 7, is for the LGU to activate a crisis communication system if necessary. For example, may incident na nagka-adverse reaction about a vaccine in your area that's gaining traction in the media. So the issues such as that and concerns tracked to the implementing units in close coordination with the local government units and other local task forces shall be consolidated at the level of the local emergency operations center. So if kaya naman ng LGU i-handle yung matter based on yung available FAQs that are provided and the available data, they can review yung FAQs and DOH platforms for a response. Pero should the matter be beyond the purview of what you can provide, you are expected to issue a holding statement in preparation for a contingency within the day according to the circumstances of the case. So the draft issue hopefully shall be incorporated in an incident report containing yung issue and the complaint and the action taken and yung remarks done by the local EOC and hopefully elevated to the regional EOC for appropriate action. And then, yun. So yung point lang dito is there are steps na we can take. So if there's an immediate concern, if it can be responded to, yes, nasa FAQs, yeah, we can respond. Pero if hindi kayang i-respond at the local level, we can issue a holding statement, then elevate through an incident report. So in our playbook, and it also included in the national plan, are some of the na-foresee namin na pwedeng maging incidents that may require or may necessitate a certain amount of crisis communication response. This is just an example na I'm flashing. It's part of, it's already contained within the playbook. So for example, there are religious or cultural groups whose practices and beliefs prohibit or against our method of vaccination. So this is an example of a holding statement that can be released. So for example, yung mga holding statement natin, COVID-19 does not recognize borders or beliefs. The COVID-19 vaccine is an important tool in increasing protection of our citizens and communities. And it is only through following the minimum public health standards, such as wearing masks, properly washing hands, and practicing social distancing, that we can move our shared goal, so emphasize on shared goal of a world protected from the threat of COVID-19. Or a sample holding statement, we respect the tradition and practices held by your group. We are committed to your health and safety, and we will work together with you to help people in your community understand why vaccinations are important and why they should be vaccinated. So this is just an example of a holding statement. This is also contained within the playbook, which we will be sharing with you through the Google Drive. So marami kaming na-foresee na possible incidents that might necessitate a holding statement or crisis communications. Yeah, I think that's it. So that's the 7-step process. This is all, again, the playbook summarizes the key steps that is recommended to be undertaken by local government units to effectively and comprehensively implement demand generation and communications. So these steps are outlined and described in detail in the playbook to be provided. So again, before I end, the key steps are establish a local vaccine. Number 1, establish a local vaccine operations center with a team for communications advocacy in partnership with a clear organization chart and key stakeholders represented. Number two is adopt a local social mobilization and advocacy microplan. Number three is facilitate town hall meeting orientations, participative planning, and other strategic activities. Step four is to conduct a modular cascade or capacity building of stakeholders. Step five is to activate social listening tools and collect data. So you can conduct surveys and other activities, for example, community listening, community assemblies. You can collect the social data on perceptions or information gaps on the ground. No? So this can help inform your microplans. Step six is to assess yung local microplan ninyo through a developed monitoring and evaluation system. And step seven is for activating crisis communications if necessary. So that's for my part. Thank you for listening very much. Thank you po.
Tara, sa Vida Vacunation!